Okay, well, I paused, so you didn't miss anything for those of you who were listening after the fact. We just had a temporary glitch. So one of the things USET is attempting to do is to better understand vaccine hesitancy amongst our tribal citizens in trying to work on campaigns or interventions to address vaccine hesitancy. We have contracted with the rescue agency who uses what's it called, the theory of change model. And as part of that, we are conducting, or actually they are conducting, a focus group of people who have not gotten vaccinated, vaccine hesitant people. As part of that, there's a brief screener questionnaire that you have to answer, and then you may be invited to participate in a focus group that's going to last 1 hour. And for that 1 hour of time, there's going to be gift cards of $125. So we have had trouble recruiting people for this. We've not gotten any recruitment. If you guys have any personal contacts who are USET tribal citizens or patients or anything like that who would be interested, please share this information with them. We'd really, really like for them to participate in that. We can send out an email after this with the information, but it's it won't be USET staff, it won't be tribal staff conducting the interview, so it will be anonymous. It is online. All their individual responses will be kept separately, and the rescue agency will be issuing a report. So I think it's really important that we do that so we can really address that. And it's not going to take more than an hour of their time, and it's something that we would really, really appreciate. Thank you, Emily. Was that the link they sent yesterday?
Yeah, that's the link that you can share or fill out.
Yeah, and we've got some QR code advertisements if you put up in your clinic or pass them out to anybody. We would really appreciate that. I am about to hand it off to Imani Ransby to discuss the current updates, but I'm very excited about this session because I think it's really needed. We've all seen the survey results that said providers are really where people get their trusted information. So I think that providers are going to play an important role in addressing vaccine hesitancy. So Kit Key has also given me permission to share these sessions outside of Indian country and outside the USET region. We have we've limited them to USET member tribes, but I think that this is important information that a lot of people can learn from, and I do plan on sharing this recording link. And who doesn't like a free CEU either? I mean, everybody likes that. So with that said, I'll turn it over to Imani, and then she'll turn it over to Dr. Bunio. So thank you.
Thanks, Christy. Yes, as Christy mentioned, my name is Imani Ransby. I am one of the staff epidemiologists here at USET. And so I will be going over some information that's featured in our USET area aggregate surveillance reports. As a reminder to those that are not aware, sorry, let me put my screen up. As a reminder for those that are not aware, we do send out these reports on a weekly basis every Wednesday, and those are sent to representatives of USET member tribal nations as well as USET staff. For our member tribal nations, this aggregate report is also sent alongside a tribe-specific report with more detailed information about what is going on in and around tribal nations. And these reports specifically focus on information related to COVID-19 cases and vaccine administration within counties and states in our region, as well as the United States as a whole. So the following slide showcases the number of positive COVID-19 tests at reporting facilities in the IHS Nashville area, as well as the cumulative total of positive COVID-19 tests, and then a 7-day positivity rate. For the current week of August 3rd to the 10th, the number of positive COVID-19 tests was at 265, while the cumulative total of positive tests was at 7,169, and then the 7-day positivity rate at 13.5%. Since our last echo on July 9th, we have seen large increases in both the number of new positives and the 7-day positivity rate. This is consistent with what has been going on in the US, as the Delta variant has now become widespread as the dominant variant circulating now. I wanted to bring attention to the percent positivity in particular. That number did go up by 10% since our July 9th echo. It was at 13.6% last week on that report. So from that, you can kind of see that we haven't had too much of a jump from last week to this week, but when looking at around mid-July, we have seen quite a bit of an increase. But the percent positivity itself right now is high, and that is indicative of seeing increases in the overall number of positive test results right now. Furthermore, that percent positivity also highlights that transmission of the virus has been on the rise as well, which does make sense, as we know the Delta variant is more transmissible. So the graph display goes into a little bit more detail regarding the number of new positive COVID-19 test results, and it gives you a week-to-week comparison of those numbers over a 12-week period. As I mentioned before on the last slide, for the current report week of August 3rd to the 10th, the number of new positives in the USET region was 265. You can see that this was a clear rise. There was a clear rise in cases from last week to this week and even previous weeks earlier this year. And as I mentioned before, since mid-July, it's when I think we really started to see an uptrend occur. So COVID-19 cases have been increasing, and as a result, we have had to really buckle down again and really start emphasizing prevention measures, which is why there has been a change in guidance in the recent weeks, with CDC recommending that we wear masks in indoor public spaces now again. This graph gives you the rate of new COVID-19 cases per 10,000, and it is broken down by USET counties, USET states, as well as the United States. We've given you a 12-week time frame here for this information too. Please note that this data is specifically obtained from CDC and state health departments, and so it's not limited specifically to tribal citizens. Although it's not directly reflective of what is going on at tribal nations specifically, we have continued to find this information to be useful, as it's been a very nice indicator for what's going on in and around the USET region and tribal nations. And we do feel and support that this information can be used to drive decisions regarding public health at tribal nations during the COVID-19 pandemic, as it does show you the number of COVID-19 cases that are being seen at a local, state, and then national level. I do want to bring attention to the peak on the graph for June 22nd to the 29th, the USET county rate. This is actually due to having a lack of COVID-19 case surveillance information available to report on for various USET counties. Florida specifically has stopped publishing their COVID-19 case information daily, so we could not pull that data for that state in particular. With that being the case, a large decline was reflected in the USET per incident rate for the week of June 15th to the 22nd, followed by that large increase you're seeing for the 22nd to the 29th. So with that peak, it is more likely that the rate was around 1 in 3 cases per 10,000 instead. We do have reliable information available to refer to for the weeks after that and for the current report week as well. So we can definitely look at those numbers to get an idea of the impact COVID-19 has had on our geographic area. The USET county or per rate for the current week of August 3rd to the 10th was at 14.06 cases per 10,000, while the USET state rate was at 21.03 cases per 10,000. And lastly, the United States rate at 24.97 cases per 10,000. I also want to note that for this past week, the USET county rate was lowest, followed by the USET state rate, and lastly, the US rate. So the US rate is showing the largest presence of COVID-19 infections at a national level compared to both the USET states and USET county rates. Although we have also seen just an overall week-to-week increase in both those county and state level data points too, as you can see from the graph. So cases are increasing all around. To kind of transition a little bit, the next few slides are going to cover some graphs that showcase the vaccination data included in our weekly surveillance reports. We do hope that you have found this information to be beneficial in tracking the progress made with vaccine administration at your tribal nation, as well as in your geographic area or region. And so the slide featured gives you the percentage of population fully vaccinated and is broken down by reporting facilities in the IHS national area, the United States, and the Indian Health Service. Please note that the bar for reporting facilities in the IHS national area is reflective of a total of 14 sites that have been conducting COVID-19 vaccinations in the national area or USET region. And these graphs are also displaying numbers from the previous week of August 3rd, as well as for the current report week of August 10th. So for the past week, the percentage of population fully vaccinated in reporting facilities in the IHS national area was at 41.9%, while the United States was at 50.2%. And lastly, the Indian Health Service at 33%. So we have seen some continued progress made with vaccine administration nationally within the IHS area and in the USET region. Overall, vaccinations have slowed down or plateaued, which is something we've been hearing. But I am happy to report that the US rate has reached 50%, or a little over 50% of the US population is now fully vaccinated. So that is nice to see.
Imani, can I just interrupt for a second on that?
Yes.
That data is as Monday is the last reporting date, right? Because we get it Tuesday and then send out the report Wednesday.
So I pulled Tuesday data.
Okay, so I think it's, okay, we do have Tuesday data. I would expect next week our vaccination rates are going to go up. Just anecdotally, I've been hearing just around the country that people are starting to come in. I went to Walgreens yesterday and they said they have given more vaccines in the last 2 days than they have in months. And if that trends elsewhere, then because this last day was Tuesday, I wouldn't be surprised to see our rates rising. I don't know if any of the other providers want to chime in, if y'all have been seeing the same thing in your clinics. I hope so.
That's awesome. I hope we really do see an increase there. So this next graph also provides some information on the percentage of population fully vaccinated, but instead it is broken down by all USET states, the United States, and again, the reporting facilities in the IHS national area. From this, you can see that the percent increase that has kind of occurred from week to week. So percentages for individual USET states appear to range between 35 and 65% for the current week, with 0.3 to 0.6% increases seen from the previous week. This kind of supports that statement I mentioned earlier with COVID-19 vaccination slowing down as a whole, but as Christy mentioned, we may see some more uptake next week, so we'll be on the lookout for that. But earlier this year, we were seeing about 1 to 5% increases from week to week. So that does tell us that things have slowed down as of now. Although we are still making progress. So that is something that I think should be highlighted. I also wanted to go over the following slide. This one gives you the percentage of delivered COVID-19 vaccination doses that have been administered. This information is broken down by the United States, USET states combined, and lastly, USET individual states. And these percentages demonstrate that for this past week, a good job was done in getting that vaccine that has been delivered to states administered to the public. When looking at the USET states in particular, I would also say a pretty good job was done this past week, as the percent is very close to that United States percent there. I read a news clipping or article recently that American Indian Alaska Natives have the highest rates of vaccinations. This was something that was mentioned earlier this year, but appears to have continued. So that is also something great to hear. So I wanted to just transition a little bit before we go into the next presentation and just go over a report that was published by UIHI, or the Urban Indian Health Institute, earlier this year. This is a great source for information regarding COVID-19 vaccine hesitancy in Indian country. And I thought that it would just be a great introduction or way to segue into our next presenter's presentation. So I'm going to spend a little bit of time going over some of the major takeaways from that report. So the article can be found at one of the following links. I have linked the full PDF report as well as a summary of the report, but both can be found at UIHI's website if you are interested in taking a closer look at that, because there is a lot of good information in there. So just to go over a little bit of background, this report was published this past January and was implemented last year in 2020. UIHI created a survey to gather information on thoughts, perceptions, and behaviors around the COVID-19 vaccine in Indian country and amongst AIANs in particular. Their primary goal with this survey was to collect information that could be used to assist with vaccine efforts and better understand vaccine hesitancy. So I do think that this is a pretty relevant article to go over with to coincide today's presentation by Dr. Bunio. So survey participants comprised of 1,435 American Indian Alaskan Natives from 46 states and 318 different tribes in the United States. The survey that was implemented was 49 questions. So there were 49 questions featured on there, with all having the aim of addressing and gathering information on individuals' willingness to get the vaccine, as well as identify trusted sources for individuals when it comes to getting information on COVID-19 and the vaccine. To go into some major takeaways now that were listed from the results in the report, it was found that 75% of participants reported that they are willing to get the COVID-19 vaccine. So most participants stated that they were willing to get the vaccine, at least the vast majority. So that was nice to see. For both groups, unwilling and willing to get the vaccine, potential side effects of the COVID-19 vaccine was a common concern. And as far as adherence to COVID-19 prevention measures, that was actually found to occur amongst those willing and unwilling to receive the vaccine, which was something interesting to me. Although it was reported that those willing to get the COVID-19 vaccine did use prevention tactics more frequently in reference to wearing your mask, washing your hands, social distancing. It was also found that 64% of those unwilling to get vaccinated indicated that they would receive the vaccine at some point in the future, with about 23% reporting that they would get it in at least 1 year from now. For the Nashville area in particular, it was found that 65% were willing to get the vaccine and 35% voiced being unwilling to get the vaccine. So just some specific information for the USET area with that. Also, I wanted to mention that hesitancy in both groups was oftentimes found to be driven by how quickly the vaccine progressed through clinical trials. Some of the things I'm mentioning are things that we've heard before in regards to vaccine hesitancy. With this next slide, I wanted to go over just a couple more things here. So 74% of all survey participants reported that getting vaccinated is a responsibility to their community. This is actually a unique feature when compared to other communities of color. Those willing really had a view of having a duty to the community and to preserve culture as a whole, while those unwilling to get the COVID-19 vaccine had more of an individual focus and thought that getting vaccinated is an individual's choice. Trusted sources or messengers are key in addressing vaccine hesitancy, primarily because they can really influence a person's judgment of the quality and reliability of the information at hand, and in return, even affect compliance with recommendations. So trusted sources really do hold a lot of weight. Healthcare professionals, IHS, government organizations, pharmacists, tribal leaders, family, nonprofit organizations, and amongst many others are some of the trusted sources that were outlined by UIHI's report. The greatest gap or difference between those unwilling and willing to get the vaccine was in regards to trusted sources outlined with government organizations such as CDC, FDA.
Imani, I think we lost you.
Can you guys hear me?
Yeah, I can hear you.
Okay. So yes, so those willing to get vaccinated had a lot more trust in those entities such as the CDC, FDA, NIH versus those unwilling to get the vaccine. Another interesting takeaway from that report was that the two most least trustworthy sources for those unwilling to get vaccinated were Dr. Anthony Fauci and scientists creating the vaccine in particular. Quickly, I just wanted to highlight just a few recommendations derived from the UIHR report. I believe they did outline a total of 6 recommendations, and they all strive to kind of drive decisions related to vaccine efforts and activities. But the first one would be to ensure vaccination campaigns have a cultural focus and highlight the unique values of the tribal community while also striving to tailor messaging and emphasize the connection between cultural preservation and getting the vaccine. A second one would be to assist urban Indian and tribal health clinics take a leading role in COVID-19 vaccination efforts, as again, from this report, we have seen that some of the most trusted sources are our healthcare providers. So really working with clinics is something that should be done or prioritized. And then a third recommendation was to use clinicians, elders, tribal leadership, and others greatly trusted in the tribal community to provide information about COVID-19 vaccines. And again, we want to make sure we have clear messaging and that all this information is accessible. And that is very important. So I just wanted to close by saying, as always, please feel free to reach out to our USET tech team if you do have any questions or concerns related to COVID-19, as well as anything outside of that. We'd be happy to assist with any technical assistance or questions that you do have. Our email address is usetinc@usetinc.org if you would like to get in contact with us. With that, I will take any questions related to the presentations that I've just gone over. And if not, then I will go ahead and pass it on to our next presenter.
Okay. Thank you, Imani. I assume by the silence that there were no questions for you. So I'll go ahead and get started with the next presentation, if that's all right with everybody. I'm Rick Bunio. I'm a family physician. I'm the clinical director for the Cherokee Indian Hospital in Cherokee, North Carolina. I'm also the medical director of the Tribal Public Health and Human Services entity. And Dr. Brown asked me if I would speak today on vaccine hesitancy, which I'm happy to do. Let me just get my presentation up. Okay, can everybody see that? Okay. So what I wanted to, talk a little bit about today is vaccine hesitancy. I want to talk about sort of the, current state we're in, some of the reasons behind hesitancy, and then maybe just recommend a couple of possible techniques to overcome vaccine hesitancy. Again, a lot of the things that were presented by Imani are consistent with what I had found in my research. To start off, I have no financial disclosures or conflicts of interest with the presented material today. So what is vaccine hesitancy? Well, the SAGE Working Group on Vaccine Hesitancy defines it as a delay in acceptance or refusal of vaccination despite the availability of vaccination services. This is a interesting table that I want to spend a little time on. This comes from the Kaiser Family Foundation, which has a COVID-19 vaccine monitor, which has a number of charts, some of which I'm going to highlight today. What I want to point out in this chart is if you follow this in sort of a temporal fashion, you can see that back in December of 2020, we had the wait and see group and the as soon as possible group were large. And then over time, the number who'd already gotten the vaccine increases up until it got up to about 67%, but it had slowed down. The number who were in the I want to get the vaccine as soon as possible obviously decreased over time. So it's a very small percentage, which I think reflects the availability of vaccines across the country. And the wait and see group also decreased significantly. One of the questions I often like to ask people who say, I want to wait and see is, well, how long are you going to wait? And it looks like a number of them have waited long enough, but there's still a significant percentage who are in this group. The group who said that they would only get this if required is a fairly small percentage, and I think this is relevant for those of us who are in organizations where vaccination is mandatory or is going to be mandatory, or for organizations where a mandatory vaccination is being considered. But the other thing, which I think is probably most concerning, is that the group who says they will definitely not get a COVID-19 vaccine has not really changed a whole lot. Since the beginning of the pandemic, where it started at around 15%, we now see that is consistent at around 14% of the groups surveyed. So we don't appear to be making a whole lot of inroads there. This sort of illustrates that there are differences depending on different demographic groups. And as you can see, some of the groups that are most resistant to vaccination are rural residents, those who identify as Republicans, and the uninsured under the age of 65. And as you can see, the ones most likely to get it are Democrats and those who are 65 and older, and college graduates. The unvaccinated adults who say they definitely won't get vaccinated appear to be less worried about getting sick from the coronavirus, and they appear to see the vaccine as a bigger risk to them than a COVID-19 infection, which appears to obviously be informing their decision not to get vaccinated. Hang on a second. Oh, here's the other another slide that the group that is says they won't get vaccinated also largely feel that the pandemic has been exaggerated, that it's just not as bad as everybody's making it out to be. This is a small study from the Journal of American Geriatrics Society looking at frontline skilled nursing facility staff regarding their COVID-19 vaccine hesitancy. It's a fairly small study looking at 196 frontline staff during town hall meetings. I selected this for two reasons. One, because unfortunately our skilled nursing facility has one of the lower vaccination rates in our health system here in Cherokee, but also because it listed a lot of things or reasons why people said they were hesitant, so I didn't have to type it out on all of my slides. So early on when they asked the staff, and this is not going to be unfamiliar to many of you who are in the field and trying to talk to people about vaccines. Early on, some of the statements were similar to what Imani mentioned. The vaccine was developed too quickly. Many people were concerned about short-term side effects. There are concerns around infertility and safety in pregnancy, and again, long-term side effects. And there was, you know, a group that just wanted to take that sort of wait and see approach. After those early concerns were raised, other concerns tended to come up. And so some of these were only, you know, triggered after those first concerns were addressed. One is that the belief that the vaccine actually caused COVID-19 or could cause COVID-19, that it would cause Bell's palsy. The fact that a booster shot is being talked about has made some people think, well, if I have to get a booster, you know, then what's the point? There's also concern that the vaccine, despite what has been, you know, mentioned over and over in the media and by providers, they're concerned that it's ineffective against the variant or variants to come. And others who had previously tested positive for COVID-19 are worried that the vaccine is going to make them feel as bad as the original infection did. And then usually some of the more, after further discussion, we get into things about whether or not it's going to actually I think improve their lives. Will they still have to keep getting tested? Will they still have to keep wearing a mask? Can they still visit with family if they get vaccinated? The infamous microchip concern then comes up after a bit more of a discussion. And then specific concerns about whether it's safe for people with different chronic diseases. So that's sort of on a national front. What's happening here in Cherokee? Well, we conducted our own small survey, and we didn't get a number of responses, but I thought it would be interesting to take a look at it. The top responses about why they did not want to get the vaccine. Number one was that people were worried about potential side effects. Number two was various concerns about the vaccine, which I'll show on my next slide. And then also, I don't trust the government. So again, it's just kind of interesting to see that a lot of these concerns are shared and similar to what we saw in Imani's presentation. So this is sort of a follow-up to that question or the response where they said that they were concerned about the vaccine. Again, scared of needles, concerned about underlying health conditions. Whether or not it's approved, fully approved by the FDA is something that pops up, you know, fairly frequently. No long-term effects known. Again, medical conditions, concern that it was rushed, fertility and reproductive concerns. This one about manufacturers free of liability under the PrEP Act, I had to look up the PrEP Act because even I didn't know what that was. But apparently, you know, that's true. It does provide some protection from liability for the vaccine manufacturers. And I think in particular, if you're in that group that definitely does not want to have the vaccine and maybe are looking at a lot of social media postings that have certain conspiracy theories in them, that's something that may give you pause. Again, worried about long-term side effects. Again, feeling that we just haven't, you know, been looked at this long enough or know the long-term side effects, that it was rushed, and just not enough studies yet. So what would happen if certain things came to pass? It appears that full FDA approval would boost COVID-19 vaccine uptake, particularly among the wait and see group. The second most effective one on this survey were if there was a lottery where they had a chance to win $1 million. I've talked to a number of people, and I've actually seen some opinion pieces that say that lotteries tend to only work for those who they solve the problem of inattention. If somebody's not getting the vaccine just because, I mean, they don't really care if they get it or not, they don't think they're really at risk, but they just haven't got around to it, then something like a lottery or an incentive like that will perk up their ears, and they say, well, if I was going to get it anyway, I might as well go ahead and get it now because I have a chance to get $1 million. It appears to be less effective in those who are determined not to get the vaccine. Other things that would make these different groups more likely to get the vaccine were if it was the employer gave them time off to get vaccinated and recover. I think some people are worried they'll have to take a day off if they get the vaccine and they have the side effects. If it was convenient, if there was a mobile vaccine clinic came to their neighborhood, if instead of having a chance at $1 million, they were guaranteed $100, that seemed to be somewhat effective. And then there were varying other things like transportation, childcare, and free tickets to different events. So what are we seeing here that much consistent with what Imani had mentioned is that personal doctors, pediatricians, their own doctors, are the most trusted sources for reliable COVID-19 vaccine information. According to this, survey, providers, healthcare providers seem to have, the highest level of trust with regard to this, even higher than Dr. Fauci. So that kind of gets to, well, what are we going to do when we try to have these conversations with patients? And so this was an interesting, op-ed piece from the British Medical Journal, which refers to resisting the writing reflex. And so the writing reflex is something where we're talking to someone and we have this immediate desire to correct something they said and tell them what to do. This is something that I think is discouraged, particularly in motivational interviewing techniques. And it appears to be particularly ineffective for those who are severely vaccine hesitant, or people who don't trust the government, don't trust that anything's coming out, that all the information is being communicated truthfully. And in fact, I had seen somewhere that even the lotteries offering $1 million can backfire in that groups who are prone to conspiracy theories may interpret that as, well, if the vaccine is so good, why do they have to offer $1 million for people to take it? So I think we have to be a little bit careful. I think, the population that was in the wait and see group, or, that were already interested in getting the vaccine, I think they did respond fairly well to, facts. But that group that is definitely not wanting to get the vaccine, that may be a less effective strategy. So what do we do? Well, this is pretty much based on motivational interviewing techniques, where the strategy, and this is a COVID-19 vaccine conversation guide, kind of instructs providers and anyone who wants to use this to first of all, get the patient's permission. There are many people who just don't even want to talk to us. They're not in a space where they even want to listen to us. And then, really take the approach of listening to the patient and empathizing with them. In my experience, there are a number of patients and even some health professionals who are skeptical and nervous about taking the vaccine. And many of them have given it a lot of thought. And I think it's important to hear them out. And so then the next step is, of course, listen and learn and try to understand what's important to the patient. You know, what are the patient's goals and priorities? And then try to talk to them a little bit about their concerns with regard to the vaccine. And again, towards the end, you know, you want to summarize the patient's goals using statements like, I heard you say, and you seem to be excited about. Excuse me, summarize your patient's questions, and then try to use lay-friendly language to answer your patient's concerns or questions. I think it's important to say you don't know. And, you know, obviously I get surprised sometimes, you know, patients will refer me to a video or tell me something that I didn't even know was on the horizon. And rather than, you know, dismiss that, I'm very careful to say, okay, I hadn't heard that. Let me look into it, and I'll be happy to get back to you once I've had a chance to research that. So I'm going to pause here for a second to see if there's any questions, and then I have one more slide I want to present to you guys.
I have a question, Dr. Bunio, and that was a wonderful presentation.
Yeah.
Did you read anything about mandating it?
Yeah, I've read a lot about mandating it. Go ahead.
No, and so I'm sorry. I'm sure you've read about it. What's your opinion on the effect that a mandate would have?
Based on that slide that I showed you earlier, it looks like it might have about a 3 to 5% impact based on the group that admitted that they would get it if it was required. It might push some of the ones who are still in the wait and see category as well. So it might be a little bit higher than that. So we're at about an 80% vaccination rate across the board here in our health system. I would expect we'd probably get around up to 90% with a mandate.
Now, but what happens if it's a mandate, what is the exception to the mandate?
Most places will offer a religious exemption. And I can't say it's one size fits all, but I do believe a religious exemption or a medical exemption, which in my opinion should be extremely rare. And I'm not even sure there are very many bona fide medical reasons not to be vaccinated, but I think that would be an exemption. That's all that we're considering here. And if somebody claims a religious exemption and we accept it, we're planning to subject them to weekly testing at a minimum until this all passes, and mandatory masking from door to door.
Sorry, I have another question on that religious exemption. So the other day, you know, with our administrator, that was brought up, and I said, okay, I have not heard of any religion making a public statement that their religion does not recommend the vaccine. And I was asking them, do you know of any, which I'm not aware, and nobody was aware of any. Like, we know that Catholic Church and the Presbyterian Church actually have recommended the vaccine. Yeah. But when you have an individual that says, so how do we define religion? Is it the individual just says, I have my religious beliefs and that's it, and we take that as their word? Or does it have to come from a statement from their church or that's an area that I have a little bit confusion on.
Right. I think everybody's confused about that a little bit. We haven't worked that out yet. In my opinion, I don't think we would just take a person's personal statement. I think it would require some sort of supporting document from a church leader. It is my impression, in fact, it's not an impression. I know that there are, at least at the local level, religious leaders who are telling their parishioners not to get vaccinated.
Oh, okay.
You know, that they should put their faith in God and, you know, to get vaccinated. would show a lack of faith. I even saw one place where somebody said that getting vaccinated was equivalent to the mark of the beast, and that when the end of times came, you would not be taken up to heaven.
Wow.
So, yeah.
Okay, thank
So
you.
I'm doomed, I guess. Any other questions?
I actually have a lot of questions, and I may have to talk to you privately, Dr. Bunio, so don't hijack this. But I think that that raises an interesting point, especially when it comes to Indian country, is where might traditional practice and beliefs within the traditional practice, and I don't want to say system, because, you know, it's not I don't think it could be really defined as such, but where does that fit in potential of religious exemptions? And have you guys heard of that amongst maybe more traditional folks in the community?
I have not personally heard of it here. I think that's a really good point. I think it will be specific, I think, to an individual tribe. I haven't heard that here. We do have the support of all of tribal leadership, and you know, many elders and well-respected members of the community here. So I have not heard that, but it could come up. Okay. Any other questions?
If
Okay.
you have a chance to talk about this, some of the steps that you outlined above, I'm interested to hear if you've translated that outside of your practice to friends, family, social media, and that,
Yeah.
and how well that's worked for you. I mean, obviously you wouldn't be phrasing it the same as you would to a patient.
Right. So
But
thank you. Yeah, thank you for bringing that up. There was one thing that I forgot to mention is, you know, the message that we've been given is that healthcare providers, you are the most trusted source. You need to start talking to your patients. But I can tell you that we had an uptick of vaccine, you know, people willing to get the vaccine, and I think it's due to some fears around the Delta variant, obviously. And one of the local counties was doing an informal survey and asking people, well, why are you getting vaccinated now? And their number one answer was, somebody I love told me I had to do it. So what we may be seeing right now is a little bit of a shift. I mean, I think, you know, healthcare providers, doctors, I mean, we've been talking about this for a long time, but right now, what we might need to do is counsel our patients who are vaccinated to talk to their families, to like leverage the relationship they have. I was just talking to someone in the office here who finally convinced her two members of her family to get vaccinated. And I think that might be another direction. Like, so you're right, you know, those techniques can be used by our patients to convince their loved ones to get vaccinated. And sometimes those conversations are, you know, listen, if grandma says you need to get vaccinated, you better get vaccinated or you can no longer come for Sunday dinner. I don't know how they're going to phrase it, but at this point, I think we need to share the message to our patients that we're counting on them too to help us with this.
that actually raises a really interesting point. Gosh, it's probably been 15 years ago. USET did a maternal child health project in which we talked to parents, mothers, fathers, and grandparents about the health and well-being of children in their community. And as we know, one of the results that came out of this, which I think is intuitive that everybody knows, is that grandparents have a tremendous amount of influence on the health and well-being of their grandchildren. And that's something we've been toying with internally, is maybe USET could offer some sort of like peer counseling training for people on how to talk to their family members about these sorts of things. So that kind of confirms my thinking a little bit. So thank you for that.
Yeah. So, and I'm happy to take questions, but I wanted to share one sort of, I don't know if it's fun, but it's fun for me, is I wanted to share something that from I wouldn't say pop psychology, but a very interesting book that if you haven't read it, I would recommend it. It's called Influence and the Psychology of Persuasion. This is a book that kind of and references many different studies about how we are sometimes influenced or to do something or to not do something. These are techniques that I always think of that probably the used car dealers are well versed in. And so there are these 7 principles that are what are called levers of influence that we may want to consider, using some of these, but also maybe a barrier to us. So the first one is reciprocation. This is where if I get something from you, I feel obligated to give you something back. You all know the return address labels that you get in the mail, or occasionally someone who will be soliciting money from you, there'll be like a dollar bill in there, and there is a natural instinct to reciprocate. Liking is also a psychological principle. There was one of the studies they referenced was they made it clear that George Clooney supported evolution. And then when they surveyed people after that, they indicated that people were then more likely to be receptive to evolutionary theory. Social proof is the idea that if everybody else is doing it, maybe I should do it too. There was one of the really, and again, this is just fun stuff to read. The one thing that improved people ordering stuff on a menu was not, special of the day or the chef's recommendation, but most popular. If you put most popular after a particular item, more people would order it. And so again, this is something that can backfire though, because if the social group of the vaccine hesitant is reinforcing their hesitancy, then that's going to stop them, right? If they feel like everybody that they know in their social circle is not getting vaccinated, they're still not going to do it. Authority may work. Somebody like, a physician or Dr. Fauci is seen as an authority. Scarcity. This is not a lever we can use right now. We have lots of vaccine, but early on, people were scrambling, particularly if they wanted, the J&J or a particular vaccine. They were rushing in to get it because they wanted it and they thought they couldn't get it. There'd be a chance they couldn't get it. I'm afraid that ship has sailed because we have lots of vaccine. Commitment and consistency. If we sign our name to something, then we are more likely to act consistent with what we have signed or what we have said. And this Dr. Cialdini wrote another book called Persuasion, where when you, for instance, if you compliment somebody on being particularly logical or scientifically minded, they're more likely to then agree to something that is based on that, because it reinforces their perception that that's who they are. And then finally, unity. I mean, I think this is being part of a group. This is one that we have tried to leverage consistently here in Cherokee, is that you are part of a community. You need to be vaccinated to protect this community. You are part of this group. Once again, this one can backfire a little bit, because if you see your group as being the unvaccinated, free thinking, not going to be, tricked by the, medical establishment or drug companies, then that will give you that kind of support to continue to resist vaccination. So once again, I mean, this is just something that, when you're, if you're like me and you're sort of hunkering down and trying not to go anywhere, it's a fun book to read. And it just gives me, pause every once in a while if we could use some of these techniques. And that's all I have.
Thank you very much. Does anybody else have any questions or comments?
I would love to hear if anybody has any personal stories of successes that they've used in that work, if they have a moment. I know my cousin lives with my dad, and my dad basically just, everybody else tried to get him to get vaccinated, and my dad just basically, it was an implied threat, get vaccinated or moved out, but you need to get vaccinated, and it actually worked. He did, so.
Yeah, we had, there was a young lady who was taking care of her mother who was, I believe, 91 years old. And it was the mother who didn't want to be vaccinated. And the daughter said, if you don't get vaccinated, I can no longer come into this house. I'm afraid I'm going to infect you and I will no longer be able to come here. And that worked.
Christy, I have a story. My mother has multiple myeloma, and caretaker that comes to help her, Republican, and definitely wasn't going to get the vaccine. And we just had to sit down and have the conversation and say that we appreciate it, and you are a family member. We want to keep you around as well. But for her safety, we need to have everybody vaccinated. And it worked. We actually took them to CVS that day.
That's great. I think as you guys, providers, see individual people, public health folks look in terms of numbers, but each person that we get vaccinated is, it's going to make a difference. And so just keeping that in mind. I know, for me, it's not just, I joke, this is all I think about. I think about it professionally. I think about it personally with myself. I think about it, locally with the school board. It's all, it's just all encompassing. And so we, within our own spheres of influence, leveraging the influence that we do have. So thank you. This was very informative.
At this point, we're trying to message, and it's not really a message, it's just the fact that all of the hospitals are full, all of the ERs are full. If you get sick from something else, you may not get the care that you would otherwise enjoy. And that's because beds are filled with COVID patients right now. So.
I'd like to draw everybody's attention to a link I shared in the chat about 10 minutes ago that's for a paid online focus or interview group for people who are, for people to share thoughts and concerns they have with the COVID-19 vaccinations, specifically USET area tribal citizens. So please share it far and wide if you can. And thank you so much, Dr. Bunio. Does anybody else have any other comments they'd like to make? Hearing none, I will encourage everyone to have a nice lunch. As I shared earlier, this has been recorded. I'm